we understand that due to the lack of time, you might be tempted to open pads quickly by shaking them. Unfortunately, doing this can damage the internal structure of the pad, so making it far less efficient. When you are folding the pad to make the correct shape for fitting, please do not twist or deform it. This can break the structure of the absorbent layers, resulting in the pad being far less efficient. If your patient is not well placed in the middle of the pad, you might try to centralize the pad by pulling one of the wings. The weight of the patient will make this impossible. The material is not designed to be pulled this hard and may tear. Elderly people very often have thin and fragile skin. Pulling the front of the pad around can be very uncomfortable for a patient, perhaps causing irritations, redness, rashes, or even blisters. Always remember to keep the folded shape of the pad in the groin to maintain maximum efficiency of the anti-leak cuffs. If they stay flat, the pad may well leak. If they are turned inside out, they will definitely leak. Positioning the tapes may seem unimportant, but getting the position wrong can lead to problems. Do not stick the tapes on the skin. Not only is it uncomfortable for the patient, but it is inefficient and the tapes will come off. If the upper tapes are positioned parallel to the belt, you may stretch the pad more than necessary, which will render the elastic belt ineffective. It is wrong to think if it's bigger, surely it can absorb more. However, if a pad is too big for the individual patient, it will leak because it will not fit correctly. You can quickly tell that the selected pad is too big when the upper tapes touch each other or come very close together. If this is the case, try a smaller pad. Patients' bodies change with age, health issues, weight and shape problems. Their usual pad may become too small to be effective. If you have difficulty making the sticky tapes reach the front part of the pad, and if the belt does not fit snugly across the abdomen, it's time to change to a larger pad. To recap, you have a correctly fitting pad when the tapes are positioned where you would normally find trouser pockets. The tapes should not be on the sides of the hips nor on the abdomen. Brushing against a patient's skin can be uncomfortable for them and may transmit bacteria from the back to the front.